I want to give a brief overview of the guidance for parents and school districts and staff. First, I want to emphasize that school-based testing should not be used alone, but as part of a layered prevention approach that includes masking, frequent hand washing, physical distancing, and staying home when you're sick. When schools implement testing combined with prevention strategies, they can detect new cases to prevent outbreaks, reduce the risk of further transmission, and protect students, teachers, and staff. All K-12 schools are strongly encouraged to develop a screening testing program to identify asymptomatic infections to prevent further transmission in schools. Those who are fully vaccinated do not need to participate in routine screening testing. Currently, 55% of our children ages 12 to 17 have received at least one dose of vaccine, and 44% are fully vaccinated. So those that are fully vaccinated do not need to participate in routine screening testing. Additionally, those who tested positive for COVID-19 in the past 3 months should not be tested as part of routine screening, since test results may remain positive for up to 3 months, even though the individual is no longer infectious. Testing should be offered on a voluntary basis, and schools should have a procedure in place to obtain parental consent for minor students. School-based testing should never be conducted without consent from a parent or a legal guardian. Testing strategies can be broadly divided into diagnostic testing, which evaluates primarily symptomatic individuals or those who have been exposed to COVID-19, and then screening testing, in which entire groups of asymptomatic individuals are tested. The screening testing matrix in the Department of Health's guidance provides recommended testing strategies based on the region's COVID-19 activity level, or CALI score. Screening testing of teachers and staff across all levels who are not fully vaccinated should be at least once a week. Student screening may not be necessary in areas of low transmission, but in regions with moderate high or very high virus activity, screening testing of students who are not fully vaccinated or random samples of 10% of students should be completed at least once a week. Students and staff who are not fully vaccinated will undergo testing based on the screening testing matrix found in the public health recommendations. Individuals who test positive should be immediately excluded from school, and school-based close contacts should be identified and excluded from school for 10 days in regions with low or moderate risk, or 14 days in regions with high or very high risk. Anyone who tests positive by rapid antigen test and is asymptomatic should be additionally referred for confirmatory testing by a PCR test within 2 days of the initial test. Asymptomatic, exposed, close contacts who are fully vaccinated do not have to quarantine, and they should just be tested in 3 to 5 days following the exposure. Additional health and safety information provided by the Department of Health and the Department of Education for school reopenings can be found in the road forward.